Welcome to Chronically Driven Podcast. I'm your host, Sandra Silva, and I'm so pleased that you can join me here today. I'm excited to introduce you not only to today's guest, but to a healing modality that may not be new, but is new to me. We're going to be talking about Fascia Stretch Therapy, which once I started to learn about, got me really intrigued. If you haven't heard of it, Fascial Stretch Therapy is a healing modality or therapy that, as you'll hear, does a body good. Initially used in sports medicine by athletes to help with optimal performance and faster recovery, stretching our fascia can increase range of motion and flexibility, provide more muscular balance and symmetry. It can reduce pain, improve posture, reduce our risk of injury, and improve overall muscle function and circulation. What I really loved learning about was just how beneficial this is of moving and stretching our bodies can be for those of us with a chronic condition like rheumatoid arthritis or fibromyalgia or issues with chronic pain, or for anyone who is carrying a lot of tension in their body. You're going to meet Alenna Langhorst, a certified fascial stretch practitioner, and we are going to learn what it is all about. Let's get started. This is Chronically Driven. All right, I would like to introduce you to my guest today. Joining me is Alenna Langhorst, a certified fascia stretch therapist. And as I mentioned in the intro, fascia stretch therapy is a modality that I myself am just learning about now. So I'm really excited to be able to bring this conversation to you today so we can all learn about it together. Welcome to the program, Elena.
Thank you so much, Sandra. Thanks for inviting me on today.
My pleasure. Thanks for being available. We're going to get into the topic pretty quick here, but I thought we would start out by allowing people to get to know a little bit more about you and your background and what led you to this work. I understand that you've been really active all your life and have pursued and excelled at a high level of athletics from an early age. Can you tell me a little bit about what you've been involved in?
Yeah, sure. So when I was a child, right up until basically adulthood, I've been very involved with sports. I started out in soccer, playing at a fairly high level, as well as volleyball, swimming competitively, skiing, snowboarding. So pretty much a full round of athletic activities. And then in my later years, I got really interested in triathlons.
Oh, okay.
And I started racing in triathlons and getting more into some distance sort of sports and activities.
Excellent. So triathlons that's pretty, you have to be pretty dedicated to your sport and to athleticism to do that. And I understand that from reading in your bio that you did start to experience some injuries and things so what happened there?
Yeah. So when I was 12 years old, that's when I would say an injury first occurred for me, unbeknownst to me, because I was really young. I was hit by a drunk driver in a car. We were T-boned. And as a result, I believe that injury really sort of played out throughout my life. And then from there, other injuries such as big falls off bikes or snowboards compounded the preliminary, so to speak, injury that I had first gotten at a really young age.
Mm-hmm.
And then when I was 30, in my early 30s, my doctor told me I had rheumatoid arthritis. When I was pregnant with my first child, I started really experiencing a lot of problems with my hip, my back, and sciatica as well. I would say this is when I really turned to yoga and other modalities. It definitely has been a journey of healing. I turned to these other modalities in order to maintain a lifestyle, a very active lifestyle that I've always had, because without my activities and being able to move freely without pain, I didn't really know what that life would look like because it's all I'd ever done.
After a couple of decades of practicing yoga yourself, I understand that you became a certified yoga teacher.
Yeah, so I practiced yoga. I was in my late 20s and started practicing yoga and really found a big difference for myself physically and mentally. Then eventually I went and got certified in, I believe it was 2012 or 2011. And from there, I just love learning. So I kept the learning going, so to speak, and went and did my certification in therapeutic yoga, yin yoga. I did family yoga actually as well. And it just kind of kept going for myself, whatever I found interesting and what I spoke to me. And yin yoga was one of the practices or modalities within yoga that really spoke to me. I was really fascinated by fascia. So that was sort of the beginning of my journey with fascia and what it can do for movement and human health and wellness.
So let's let our audience know what we're talking about when we say fascia, because that may be a term that not everyone is familiar with. So, like I said, this was new to me, and I did a little bit of research, and according to the Fascia Research Society, fascia is the most pervasive but perhaps least understood network of the human body. And it is the thin casing of connective tissue that surrounds and holds every organ, blood vessel, bone, nerve, fiber, and muscle in place. Did I kind of get that right?
That was fantastic. Yeah, that's exactly how fascia, connective tissue, is defined. And not only that, they've also recently learned, there's been some studies about if it has sensory nerves, and they found that it actually does. So fascia is also very intelligent, as well as something that binds us and keeps us mobile and active.
Okay, so it's everywhere in our body, and when it's in its healthy state, it's like fluid and thin and movement and but then what tends to happen to fascia when it tightens up? What's that process?
So often what will happen due to injury, and some now they're looking at the role that fascia has on disease as well.
Mm,
And this is a fairly new topic, so there's not a lot of research to date. There's more than there was, let's say, in 1980 when it started sort of being first talked about. But definitely there's research that's still needed and that they're working towards on diseases such as autoimmune. Alenna Langhorst. So she looks at like what is the role in fascia and rheumatoid arthritis, for instance. And so there's not still a lot of science behind that, but fascia is something that they're thinking can play a role with disease, obviously mobility, which we
mhm,
discussed, and um, emotional stress, because like I
mhm.
said, there's been some studies done on the sensory nerves that reply or respond to mechanical and chemical stimuli. So yeah, it's exciting, and it's something that's sort of we're still learning about as we move forward.
It is exciting, and I find that so fascinating that I mean the human body is something that has been studied and looked at for I mean through medicine and through different modalities all along, but we're still learning. And I think fascia fits into this category as well because it's been there all along. When I was doing the research, I was looking up. Have you heard and have you looked at the plastinates, the fascia plastinates? Now, I'm going to tell people I wouldn't necessarily recommend you go look that up on the internet because it's a little creepy looking. So what it is, it's the model of the human body, but stripped down to so that you can see this actual connective tissue and the fascia. I think there was actually an exhibit in Vancouver at Science World or something about that. Do you remember?
Yeah, I can't remember when that was. It was a few years back. Yes.
Yeah. Yeah. But that is, I mean, so that is, like you said, there's not tons and tons known about this, about fascia itself, but also the modality, but it is being studied. People are fascinated at this and its connection. So it's something that you're probably going to be hearing more and more about. So now that we've kind of defined what is fascia, why would we want to stretch it and how would we go about doing that?
Fascial stretch therapy is a table-based therapy that's done on a massage table. The client comes in and the therapist will assess the active, passive movement and functional planes of the client. And
So
then
sort
based
of
on,
where they're at that moment kind of
yes,
thing. Yeah.
yeah.
Okay.
And then it's a customized therapy, and we start looking at where's the body locked, where's the resistance, and how can we unlock or unwind those connective lines or those tissues. And we work with the connective tissue system rather than just looking at or treating an isolated muscle or an isolated part of the body per se.
Oh, so it's not massage. This is an assisted and a guided stretch. So the therapist takes you through these movements. Is that right?
Yeah. So if, for instance, we were working on, let's just say somebody that has a hip issue, let's
Mm-hmm.
say. So we wouldn't just look at the whole hip. We would actually, there's two straps that are on the table. Let's get to that first. So if you're working on the lower body of a client, we
Mm-hmm.
strap in one leg so it stabilizes the person so we can freely move and stretch the other leg. And like I said, I really want to drive home the point that it is a non-painful treatment. There is communication. The therapist is really feeling and seeing what that tissue is doing. Like, is it locked? If it's locked, can we go in a different way? So for instance, somebody that comes in with a hip complaint, we might not even, we'll get into that hip, but
Mm-hmm.
we'll be looking at the leg, the full leg. Maybe it's the outside of the leg if it's an outer part of the leg, or maybe it's the internal part, the lateral line, the medial part of the inner thigh, all the way to the arch of the foot. So
Okay.
yeah, and so we start moving different parts of that line. And again, we move, we test, we assess.
This is very, very individual from one person to the next. It's not like a standard, menu item that, oh, okay, you're going for this. It is, and also individual from any given time. It's like what is actually going on in your body, and you feel and you see where there's tightness or resistance.
Yeah, exactly. And I like to think of it as it's a dance that I'm
Okay.
basically, you're taking the body and you're sort of moving it and gently inviting it into places. And sometimes it's too passive, and we need to get some strength in the connective tissue as well. It's gone too slack. So there's different techniques that we use. We use a lot of traction is one. And again, this is dependent on the client. I really want to be clear on that. So somebody that has a dislocated shoulder, it dislocates easily,
Mm-hmm.
we are not going to be doing traction on the shoulder. So, but generally speaking, so what they have found is that when we create space in the joint, everything sort of moves from the joint out with this type of therapy. That's the premise of one of our intentions, so to speak, when we work, is we work from joint out. And the reason being is that the joint capsule, once it gets space, it starts to free up and it creates a little bit more mobility than if there wasn't just a little bit of space and a little traction that's been given. We do also a lot of oscillation, again, just to warm up the joint prior to sort of any gentle traction that we're giving. And again, I just want to drive home that it is a very specific, customized therapy. So for instance, somebody that's younger, younger kids and whatnot, they're not going to need that type of traction because their joints aren't compressed. They're growing still. So again, it's just really individualized, the age group, where that person's at, what's going on in their body. And that's really how we treat is taking all those things into consideration and moving people, looking at the alignment, seeing if there's something else locked up in a different part of the connective tissue that you might not even think of.
So just trying to think like who would benefit from this, and it could be you would be going for sometimes for a specific reason.
Yeah, so basically I always like to think of it as anybody that is human and has a body is going to benefit from fascial stretch therapy, because as you mentioned in the introduction, this is such a big part. It's the biggest system in our body. It's these sheets and it's these bundles and strings that connect everything internally inside of us. So I've had clients that are really wound up emotionally, for instance, that are really stressed out, and they're holding in their body, they're holding in the connective tissue, and it's creating immobility or lack of flexibility or pain even. So allowing some space in that tissue to allow that stress and those emotions that's trapped in there is going to give relief and end up walking away feeling more relaxed, as well as I've had people with autoimmune diseases come for treatment, in particular rheumatoid arthritis.
Which I have, and you mentioned that you have had that as well. I mean, you started right. Anybody who has a body. So anyone who's listening, that's basically all of us. But targeting specific things to allow that space.
Yeah. So again, it can be, I've had clients with scoliosis, for instance, coming as well. They come for their maintenance, just to get some ease and sort of help things move just a little bit, even though there's structural stuff's going on for them. But just moving that tissue that's been really stuck in those places for them gives relief and decreases the pain and allows them to move in a more free way. I've also had clients, obviously athletes come, trainers come, had people with hand issues, construction workers in particular, or people that grip a lot and end up like this. So they'll have really tight extensors in their forearms. So we're working with arms and shoulders and chest and neck. So basically, I would say any human body would benefit from fascial stretch therapy.
Let's talk a little bit about how you mentioned that people, if we're holding on to stress, that we can actually feel that in our bodies. That is so true. And for talking about this for listeners of mine with chronic illness or autoimmune, I think that we often are holding a lot of stress and tension and tightness for a variety of reasons. And some of those can be from having pain and discomfort. If you have ongoing chronic pain and discomfort, that tends to, in and of itself, cause you to tighten and stress, or just the things like as we're describing it, or you're talking about it, I can feel it's like I need one of these sessions right now. How things are tightening up, and it's getting constricted, and we don't always allow for that sort of exercise and movement is good, but to be able to get an assisted actual stretch through this modality, I think is so interesting, because it's so you use straps. I want to give people a visual for this. So you have a massage table, and the reason that you will put a strap or put one leg held down is to allow a fuller stretch from the other side. If people, this is radio, but I'm doing an example here with my arms. It's kind of ridiculous.
Yes, that's exactly right. So generally we have two straps on the table. And like I said, when we're treating lower body, in order to get a deeper range of movement, we want to stabilize the one leg. So basically you're not sliding off the table. And somebody that is in chronic pain, I want to point this out. The session's going to look very different than somebody who, a 28-year-old who weightlifts, let's say.
Right.
Those sessions are going to look very, very different, just because, again, it's different bodies, different ages, and things that are going on. So people that are in chronic pain generally have a heightened nervous system. And so I would say the first session is allowing that person to trust, and that this is gentle, and I'm not going to take anybody anywhere that they're not ready to go. And that's where the dance comes in. It's like, I'm going to go a little over to the left. Oh, you're not ready to go to the left. We'll go back to center. We'll, do a little circumduction and a little rotation of that joint and see how that feels. And then let's see if we can go left. Oh, can't go left. Let's try something else. So it's really, again, I feel like it's this dance, and Frederick, who trained us, she was a dancer, and she often says, okay, she refers to dancing with your clients.
No, I like the way that that description is, and it's also in you're assessing and monitoring and adjusting by what you visually see and feel from that person. Like, so it's not a prescripted dance. It's not you're very fluid and responsive to that, and you communicate with your client during so to get their input.
Yeah. So that's also really key. I'll ask questions, client will give feedback. And I don't know if I mentioned this earlier, and if I hadn't, I should have. And so I'll mention it here, that breath is really, really important as well. There's, I don't know if you know lots about breath, but there's lots of research that points to the role of breath, and once the breath is calm and longer and deeper, then we're doing so many great things for our body, in the sense that we're tapping more into the parasympathetic nervous system, allowing that calmness, that relaxation, and then from there we can move the fascia a little bit easier versus when somebody's holding breath. So another thing that when we're treating somebody is I'm also listening and looking for breath.
Right, because that's a really good response of, holding breath, and like the shallow breather. You know what? I'm thinking, I don't think there's been a guest on my show that we haven't, that breath and controlling breathing and taking deep breaths and hasn't come in, because it's again, it's like one of those things, we all know how to do it, but do we?
Yeah, we do a lot of that. It's interesting, and how much we'll hold breath. And so just taking a couple deep breaths together, even to allow the body to let go and to be trusted. Like, sometimes it's a little bit intimidating to just let somebody take your leg wherever they want to take it, or your arm or your shoulder. If you've never done it before, there's a little bit of
establishing that trust in that and that rapport. First of all, if it's a new modality that someone hasn't tried before, a new practitioner, all of that sort of stuff. So getting a little bit of grounding before you just do what you will with a client's legs. That sounds that sounds good. When you're doing a session for a client, what how long generally is it, or does that vary as well, or what does it look like?
So the first session that a client has, I recommend 90 minutes, because it's going to be a little bit deeper and a little more involved, getting the history, the background, and doing the assessment and whatnot. And then generally on the table, 60 minutes is it's fast, actually. So that first session's about 90 minutes, and then afterwards I recommend 60 to 90 minutes for further treatment.
Mm-hmm.
And the amount of treatment sessions that you're going to have is again going to be dependent on the person, how stuck the fascia is, how much scar tissue there might be, or adhesions, or sort of blockages or restrictions, or
Mm-hmm.
and how long that person's been living in balance, so to speak. And some people respond quicker, some people don't. Generally, you'll see results within the first session. You're going to see
Mm.
results. So we like to say, give it at least 3 tries
Mm-hmm.
to really see the impact and the benefits of the therapy.
Yeah, and I mean, it would, like you're saying, depending on why you're going in there. Are you working on something specific from an injury? Is there scar tissue? Are you going for, just as you would going for a massage or a counseling session? It's, you're doing this for you. You're checking in. This is something, a treatment for, I mean, your mind, body, and soul. Because I mean, when we are able to, I can imagine a relief of and a release of having those tissues being worked on in a way that that doesn't normally happen. There are so many cool modalities out there, and this is one, like I said, that I'm anxious for people to learn about, because I think it can be so beneficial.
Yeah, and having said what it feels like after a client's had treatment, I'll often get comments as, "Oh, I feel light. I feel light. I feel warmth," is another one. People will feel warm, like there's like warmth running through their
Mm,
body. And then I've had clients tell me they report that they sleep better, they feel more relaxed, they have a greater range of movement. And after the therapy too, I always say to everybody, please make sure you hydrate, because fascia loves hydration. It is not, it's not necessarily the same composite, or it's not made up the same as a muscle per se. It's very sort of goopy and
mm.
fluid, and likes to move and slide and glide. So really important to hydrate whenever you're working with fascia. And I had one client, nod and say, yeah. And then the next week I said, so how are you feeling? How did it go? Da, da, da. And the client says to me, oh, I was so thirsty. I couldn't believe it. I didn't believe you that I would, need to drink.
Wow, huh? So even a noticeable like that, and I mean, that's another thing. Like, we we need to bless our bodies with water, with hydration, drinking water, and making that like an ongoing habit at any time is so important. But yeah, to help replenish that. Isn't that interesting that afterwards that your body is like, it's almost saying thank you, and I want to get some more. I want to be rejuvenated with hydration.
Yes.
Yeah.
Yeah, exactly.
Huh. So are all of the movements done on the massage table, or is there anything that's in a standing or sitting position, or?
Yeah, so there is, I also incorporate sometimes what's called active isolated stretching, depending again. So my background is really varied in terms of different modalities that I've studied and that I'm certified. And I was certified by Stretching Canada and an active isolated stretching acronym AIS. Sometimes I'll use AIS on clients, in particular for takeaways. So after the treatment, I generally like to give at least one exercise or stretch, depending
Mm,
again on the client, just to help keep that balance going as long as we can in the connective tissue. So sometimes, depending, we might do a seated, and also even with fascial stretch therapy, sometimes we do it in seated on a stool or a chair. It just depends again on how I think the fascia should be moved.
mhm.
Or yeah, sometimes there is seated. Standing trying to think if there's any standing. If there is, I can't think of anything besides maybe a foot release with some balls on the bottom of the foot as a takeaway extra, as a takeaway for home. If the bottom of the foot is sort of contributing maybe to the back line, maybe somebody's experiencing low back pain or hamstring issues, then, we might do a little bit of breaking up of the tissue underneath the foot.
One of the things that is really nice about hearing and learning about this modality is that it kind of has a nice fit with a lot of the other ones. I know you mentioned that you have studied some different ones, active isolated stretch. And what other modalities do you have? Can you tell us about?
Yeah, so I have a little bit of a toolkit, so to speak.
Okay.
And as I mentioned before, AIS, active isolated stretching, is one of them. And another modality that I've studied and I've taught in classes and in private is Pilates, as well as I was trained by Rad Roller, which focuses on rolling and releasing fascia with rollers, balls, foam
I
things.
see people doing that at the gym. They're doing those, they're rolling out their legs.
Yes. Yeah. So I've had some training with that as well. And I just think it's a really nice toolkit for myself personally, for my own wellness. I use a lot, pretty much everything I've been certified in, I use on myself daily or at least within my week. And as well for my clients. And I think that's what's so fun. And
I mean, it's never just one thing, right? It's all these things that work together, and it's like the healthy habits and our lifestyle, and with different modalities, and how that it's more than just a one thing. Having access to a lot of different ways to support our wellness is what it's all about, I think.
And that's the beauty about fascial stretch therapy, is that it gets into those places that are locked and you can't get into as well on your own per se. Grabbing a ball and sticking it in there, you're only going to get that one isolated place that you're trying to roll out that connective tissue. Whereas when you're working with a therapist, we're taking the whole arm line and we're lengthening and moving and creating that mobility throughout the whole arm line, versus that one isolated spot that might be sort of grabbing you in the front of the shoulder, or wherever you're feeling immobility or discomfort.
And also, with the therapist, you have that additional tool of being able to observe and to feel that resistance, so that you help guide along that process. So yeah, that sounds really great. So with all of these things that you are doing, what sort of services do you have? Do you have anything upcoming that we can direct people to?
Yeah, so I'm treating clients one-on-one. I'm have a space where I have the safety protocols of, obviously right now we're in COVID, so being really mindful of wearing masks.
We're on Vancouver Island, so this is for Nanaimo. So if you're in the Nanaimo area, that's your physical location is there. So that is that's great. You get protocols in place so that you can still run your business. That's awesome.
And then in addition, I do classes. So for those that are wanting to learn how to move their body and sort of comb through those connective tissues and those lines, I offer a couple different classes in person at Fine Balance Pilates Studio in Nanaimo, and I teach there Fridays. I do a rolling class and a fascial stretch class, and also a Pilates and stretch class as well. And I also offer online classes, and I do online privates with people as well. So those that are wanting to learn how to move and stretch the connective tissue in their body, but prefer to do it in their home, one-on-one, that's a really nice way to sort of move into a class setting or onto the
Mm-hmm.
table, especially right now with everything going on.
Well, yeah. I mean, so having that option for an online, and for those of you that are not in our local area as well, that is an option. But the being able to do either at your studio for some one-on-one, or at the Pilates. What was the name of the Pilates center again? I'm sorry, I missed it.
It's Fine Balance Pilates.
Okay.
It's on Wellington. I just moved here recently, so I'm sort of learning my geography, but I
Geography.
believe, yeah,
Yeah. Well,
I
what
think it's on Wellington.
Okay, that's a street name in the city. So good job.
Okay, yay.
Yay! What we will do is I will put all of those. I'll put the links and everything in the show notes, so that people can refer to that. And Alenna, where can people get in touch with you? How can they learn more, or if they want to book a session?
Yeah, so if you're interested in learning more, I have a few videos that are posted on my Instagram, Facebook, and my YouTube channel. It's Stretch Westcoast. I believe the Instagram is Stretch, and then there's an underscore and West Coast.
Okay.
That's a really great way to get a hold of me, message me through those platforms. And if you don't have those platforms, my email address, which I believe you'll be putting up at the end of the show,
Mm-hmm.
is another way that you can reach out to me and find out more, or connect with me if you have any questions or just want to
For those that
chat.
are not listening to this on the podcast, but are listening on the radio, can you give us the email address here on the air so people can jot it down?
Yeah, sure. So my email address is Alenna Lang at Gmail. So Alenna is spelled Alenna Lang, Lang at gmail.com.
Perfect. And like you mentioned, we will absolutely put those in the notes, so that if you can always look at that when you are ready. I would really encourage you to take a look at this modality. I mean, I just thinking about how prevalent fascia is in our bodies, and how much we hold on to tension, and being able to get that helping us on a therapeutic level, not just for how it feels, but for any of the chronic conditions that we may be living with on an ongoing basis. Elena, I think this has been fantastic. I know personally I've enjoyed learning about this topic and digging into it a little bit more, and learning from you as well. So I really thank you for taking the time to come on to share this with our listeners.
Thank you so much, Sandra. It was a real pleasure to be on the show and to chat with you.